Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan and here is what I bring to you all from the world of medicine. Sugar and candies are the most favorite snack for kids. They are pampered with high levels of intake of candies, toffees, chocolates and even cakes. And we all know that all these have a major composition in them as sugar. Now, we also know for the fact that sugar is extremely bad for our teeth, which can lead to cavities and various gum infections, especially in children. Now, so what is the solution for all this? Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan and today I am going to discuss about the effect of sugar-free diets on dental caries. A recent study investigating the relationship between free sugar intake in early childhood and dental caries at the age of 4 to 6 years was presented at the 100th General Session and Exhibition of the IADR, where sugar-free consumption was measured in children that were enrolled in the Barwon infant study at the age of 18 months and 4 years. The prevalence of dental caries was obtained from previous dental records. Now, out of the original birth cohort, dietary as well as dental caries data were both made available. It was found that 70.4% and 36.7% participants, they consumed less than 5% of total energy intake from free sugars at 18 months and 4 years respectively. Also, the dental caries infection was associated with 46.7% of the children. The authors hence concluded that between 18 months and 4 years, free sugar consumption increased markedly with 2/3 of children exceeding 5% of the total energy intake at 4 years of age. However, early free sugar intake increases the risk of dental caries that we all should be aware of, specifically for the age group of 4 to 6 years. How crucial decisions on mental health of parents on children during the perinatal growth are. Perinatal mood disorders such as postnatal depression and perinatal anxiety may affect both the mothers and fathers simultaneously. Now, as per a new systematic review and meta-analysis, this was shown. The previous studies show that a history of mood disorders increased possibility of developing a common mental disorder in parents. Around 3 in 100 couples were found to both suffer from late postnatal depression, which occurs 3 to 12 months after a child is born. Meanwhile, in approximately 2 in 100 couples, the parents experienced antenatal depression, the depression which happens before the baby was born, and early postnatal depression, which lasted up to 12 weeks after the birth. The study published in the JAMA Network Open analyzed 23 studies with data from close to 30,000 couples who had low-risk pregnancies. The findings showed that mothers who experienced psychosocial factors such as early life stressors, limited social support and exposure to intimate partner violence were more at risk of developing a perinatal mood disorder. While if I talk about the fathers, the main factors associated with an increased risk of perinatal mood disorder were low levels of education, unemployment, low social support and even marital distress. Perinatal mood disorders are associated with adverse pregnancy outcomes, impairing bonding with the newborn and behavioral problems in their children. The co-occurrence of mood disorders in parents may definitely amplify these negative outcomes. The authors hence concluded that perinatal depression can follow a protracted course. Most men and women who have depressive symptoms at 4 and 8 weeks postpartum continue to have symptoms at 6 months postpartum, and some develop symptoms even in the later postnatal period. Neurodegenerative disorders that are caused by long-term COVID. A new study found that those who had tested positive for COVID-19 were at an increased risk of Alzheimer's disease, Parkinson's disease and even ischemic stroke. Now, out of the 9 lakh individuals that were tested for COVID-19 within the study, the researchers found that approximately 43,000 people who tested positive had a 3.5 times increased risk of being diagnosed with Alzheimer's disease, 2.6 times with Parkinson's disease, 2.7 times with ischemic stroke and a 4.8 times increased risk with intracerebral hemorrhage. Now, while neuroinflammation may contribute to an accelerated development of neurodegenerative disorders, the authors hence highlighted that this could be a possible long-term sequelae of COVID-19. The frequency of other neurodegenerative illnesses such as multiple sclerosis, myasthenia gravis, Guillain-Barré syndrome, and narcolepsy did not increase after COVID-19. Hence, the researchers concluded that these findings will help to inform our understanding of the long-term effect of COVID-19 on the body, and that infections can play a role in neurodegenerative disorders and stroke. How technology can help predict oral cancer. According to a recent study, visual oral examination was performed among around 1,500 participants of a community-based screening program. Each individual's status was defined as positive or negative for oral cancer, and histological confirmation of epithelial dysplasia and squamous cell carcinoma was performed for positive status. Information on demography, habitual, lifestyle, and familial risk factors were all obtained, and expired carbon monoxide levels were also assessed using a monitor. Now, the input features and histologic diagnosis were used to postulate around 12 machine learning algorithms, and the study then demonstrated that machine learning is a successful tool for predicting oral cancer risk, as it deemed successful and may be applied to identify at-risk populations in opportunistic as well as organized screening. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.